The clinical applications of cryotherapy.
Ice packs or cold packs include plastic bags filled with crushed, chipped, or flaked ice, reusable cold gel packs consisting of a silica base and an antifreeze gel, cold compression therapy units which are using cold water to provide cold and compression, and instant cold packs which use a chemical reaction to produce cold. Ice packs or cold packs are good to use when someone has an acute injury. We can also use them to help prevent edema, and they're convenient when our athlete or patient needs to go. Indications for the use of cryotherapy include swelling, soreness, pain, inflammation, muscle spasms, neuralgia, and central nervous system spasticity. Contraindications for the use of cryotherapy include open wounds, circulatory insufficiency, anesthetized skin, deep vein thrombophlebitis or DVTs, cardiovascular disease, allergies to cold, or sensitivity to cold. For precautions, we need to be careful on the perineal or ulnar nerves as they're very superficial. Avoid the face, eyes, and other sensitive areas, and be careful around anesthetized skin. The treatment duration depends on the treatment goal, target tissue, and the amount of subcutaneous adipose tissue. Typical treatments are approximately 20 to 30 minutes long depending on the body part. There are different modes of treatment which include ice bags, frozen peas which are just as effective as other resources, reusable gel cold packs, instant cold packs, as well as other resources. Ice has a temperature of around 32 degrees Fahrenheit, and therefore the risk of getting frostbite or chemical burns is minimized with the use of crushed ice or an ice bag. The temperature of the body will melt the ice and will result in a heat pocket which protects the body. We need to be very cautious with reusable chemical packs. It has been documented that these cold packs can get as cold as 12 degrees Fahrenheit and therefore is much colder than ice. The body does not always recognize this cold as being colder than ice. These treatments should have a barrier between the patient and the ice pack to reduce the incidence of chemical burns. We also have to be concerned about reusable cold packs leaking and thus creating other mechanisms for chemical burns if the material seeps into the skin. Same thing with instant cold packs. We have to worry about the chemical reaction as these chemicals could burn the skin and cause other issues. There are several considerations for the use of ice packs and cold packs, including the number of treatments per day, will there be enough time for tissue rewarming in between treatments, and patients can have treatments no less than 2 hours apart. Oftentimes, ice packs or cold packs are combined with compression and elevation to enhance the treatment. Again, reusable cold gel packs should not contact the skin. There is a potential that the body weight could puncture the reusable pack and may cause it to leak. In addition, patients sometimes have a difficult time moving if they're in pain, and therefore if the pack starts leaking, an injured patient may not be able to move quickly enough to remove the leaking ice pack. As far as insulation is concerned, in the case of an ice pack, applying an ice pack over a damp towel is the most effective form of treatment. The towel provides a barrier between the pack and the skin, and the wetness creates a better conduction for the transfer of coolness to the tissue. Again, this is needed only for reusable cold gel packs only. The treatment that is most associated with frostbite is either a reusable cold pack or a chemical pack, as both of these options could get colder than freezing and may result in chemical burns and frostbitten tissue. The comfort level of the patient is very important, but remember that we have to go through the 4 sensations of cold to reach numbness. Remember CBAN? Cold, burning, aching, numbness. You need to make sure that you are reaching numbness, which will take at least 20 to 30 minutes of treatment. Skin temperature is not a good indicator of the effectiveness of cryotherapy treatment programs. Remember that the skin is the first structure to cool, but the target tissue is located most of the time much deeper than the superficial structure of the skin. The skin is not an accurate predictor of intramuscular temperature. The best way to measure intramuscular temperature is to place a thermometer within the muscle itself. Placing a thermometer within the muscle is not very practical for everyday clinical use. But this is why we use evidence-based medicine and base our protocols off of other research so that we can figure out what is best for our patients. been some studies examining the differences between cubed, crushed, and wetted ice. One great study was done by Dijkstra and colleagues in 2009. The hypothesis of the study was that the wetted ice would be the coldest, followed by the crushed, and then the cubed. Here are the results of the study. These graphs demonstrate that the wetted ice was indeed the coldest, but the cubed ice was second, and then finally the crushed ice over a period of 20 minutes. Patients were then followed for 100 minutes to document tissue rewarming. An additional study examined the different types of compression resulting in decreased intramuscular temperature. The study by Tomczak and colleagues was published in 2010, and it examined the use of flexi-wrap, elastic wrap, and no compression on intramuscular temperature of patients. Each patient was subjected to 3 treatments randomly while intramuscular temperature was taken at the gastrocnemius muscle. The study demonstrated that patients saw the greatest temperature change in the elastic wrap compression group, followed by flexi wrap, and then none. The difference between the elastic wrap and flexi wrap were not massively different compared to the no compression group. From these results, if the use of an elastic wrap is available, it is the best treatment. However, many clinicians know that if an elastic wrap is issued to a patient, it will typically go home with the patient and then will not come back with them on their next visit, thus making elastic wraps an impractical and costly compression option for many patients. Flexi wrap, on the other hand, uses single-use, disposable, and is cheap, but also results in significant decreases in tissue temperature as a compression device. Therefore, it remains the compression option of many clinicians, especially if they're leaving the clinic for treatment. Cold compression units are the combination of chilled water to provide cold and compression simultaneously. Cold compression therapy units are good to use with active inflammation, acute injury, pain, or chronic pain. Indications include swelling, acute injury, chronic injury, and edema. Contraindications include open wounds, circulatory insufficiency, anesthetized skin, deep vein thrombophlebitis or DVT, cardiovascular disease, allergies, and sensitivities to cold. In addition, body type or fat distribution may also be a contraindication depending on the target tissue. Precautions: we need to evaluate blood pressure. We also need to evaluate for circulatory insufficiency. The duration of the treatment is typically 20 to 30 minutes. There are many different types of cold compression units, including CryoCuff, Game Ready, and the BioCryo, in addition to others on the market. Cold compression units are good for treating large areas of edema, especially those associated with acute injury or post-operatively. Considerations for the use of cold compression units include taking the patient's blood pressure. The diastolic blood pressure must be evaluated for the BioCryo unit. We also need to be aware of unstable fractures and compartment syndrome, as any increase in pressure for these 2 injuries is contraindicated. Cold compression units are frequently combined with elevation to enhance the effects of treatment. The CryoCuff is a low-tech version of the cold compression unit. This unit costs approximately $125 to $150. The way the CryoCuff works is by placing 4 liters of ice and water within the thermos. The thermos is then elevated and the cooler fills and pressurizes the cuff. The compression is controlled by gravity and is proportional to the elevation of the cooler. For example, if the cooler is 20 inches above the cuff during filling, the applied compression will be approximately 35 millimeters of mercury. When the body heat warms the water within the compression device, it is rechilled simply by lowering the thermos. The one drawback of this unit is that the water does not circulate on its own, and it requires someone to elevate and lower the thermos to change the water within the compression unit. The Game Ready has become increasingly popular, but is much more expensive than the CryoCuff. The Game Ready machine costs approximately $2,000 for the machine itself, and then each additional part costs about $100 each. The Game Ready machine allows for a motorized circulation of ice water through a compression device. The Game Ready machine runs by plugging it in an AC electrical unit into the wall. The Game Ready does not require much work on the clinician and will maintain a specific temperature for the entire duration of the treatment. The BioCryo is a little bit older form of a cold compression unit. This unit requires that the extremity devices be kept in a freezer. A stockinette or a barrier must be provided in between the skin and the extremity device when applied to a patient. Once the extremity compression units are properly cooled, they can be applied to the patient. This unit uses a gradient and is sequential in its device. There are 4 chambers on the leg or the arm which each compresses the body part sequentially. Before the treatment, you must take the patient's blood pressure. The pressure setting for the unit should not exceed the diastolic blood pressure of the patient. When setting the unit for the upper extremity, the pressure should be less than 50 millimeters of mercury. This machine is fairly costly. The machine costs approximately $1,600 for the machine and comes with several attachments, including one arm and shoulder, one half leg, and one full leg. Remember, all attachments must be kept in a freezer as well, which makes this cold compression unit impractical for traveling as access to freezers is not usually readily available. In addition, the repetitive use with many patients requires multiple sleeves and may require the purchase of more than one unit. Ice massage is when water is frozen in a paper cup and then is massaged over a small area of skin. Ice massage is good to use with shin splints, specific points of pain or spasm, and applying cold with pressure, for example for a deeper and quicker treatment or for trigger point therapy. Indications include swelling or specific areas of pain. Contraindications include open wounds, fractures, circulatory insufficiency, anesthetized skin, DVT, cardiovascular disease, allergies, or sensitivities to cold. As a precaution, we can use an ice cup massage possibly with someone with anesthetized skin because the cooling is not nearly as intense as using an ice bag or an ice pack. Ice cup massage works well on small areas, typically good for spasms, contusions, or shin splints. It is not a good treatment for acute sprains, especially for ligamentous damage, but can be effective for acute strains such as tendon or muscle damage. Typical treatment duration is somewhere between 5 and 15 minutes or until the tissue reaches numbness. Several contraptions have been created for ice cup massages. The picture on the left has a plastic handle that fits into a cup which gets filled with water. When the lower cup is separated, the plastic handle keeps the clinician's hand from being cooled, which makes it more comfortable for the clinician. The picture on the right is another cryomassage tool. The water is frozen in a push-pop type container, and then the ice cup is then allowed to be pushed up as the ice gets used in much the same manner as a push-pop ice cream container. Cryostretch is the use of vapocoolant sprays, a liquid that quickly evaporates and cools the skin. It is applied to the skin while the underlying muscle and fascia are simultaneously stretched. Cryostretch is used for treating trigger points, local muscle spasm, and other myofascial conditions. Contraindications include open wounds, circulatory insufficiency, anesthetized skin, DVT, cardiovascular disease, allergies, sensitivity to cold, body types, also fat distribution, possible allergy to the vapocoolant, and possible acute inflammation. The vapocoolant spray may also be flammable, which we'll talk about in a minute. Precautions include the flammability of the vapocoolant, possibility of frostbite, and possible allergic reaction to the chemical. The spray and stretch technique includes being 12 inches away from the tissue and spraying the entire muscle length in a sweeping manner. The sweeping only occurs in one direction. This treatment is good for trigger points, local muscle spasm, but there are several contraindications. There is a potential for frostbite of the patient if you spray too close to the skin. The vapocoolant may also be flammable, so be careful when using this treatment if you are on a sideline close to heaters or if the patient is a smoker. The risk of flame is increased if the vapocoolant spray includes the chemical ethyl chloride. In addition, the patient may be allergic to the spray. If you use this close to the face and eyes, make sure to protect those vital structures. Also, because of the potential of inhaling the spray, have the patient turn their head away. Or you could block the spray from going in the face. If the fumes are inhaled, ethyl chloride can become a general anesthetic, so be careful of the patient's potential to pass out or appear loopy after the vapocoolant is inhaled. There are some questions as to the effectiveness of this treatment. The vapocoolant does not actually change the tissue temperature like other cryotherapy modalities. Therefore, the spray and stretch technique may not be as effective as if other cryotherapy modalities are utilized. An ice immersion is a tub or bucket that is filled with ice and water and is used for cooling large and/or irregularly shaped areas. The body part is usually the foot or the ankle, or the elbow, wrist, or hand. It becomes immersed in the solution. Ice immersion is the most uncomfortable of all cold treatments. Ice immersion, including cold whirlpools, is good to use with large areas, muscle soreness, or bony areas. Indications include swelling, acute injury, especially those of irregularly shaped distal body parts. Contraindications include infection, open wounds, circulatory insufficiency, anesthetized skin, DVT, cardiovascular disease, allergy to cold, sensitivity to cold, and body type or fat distribution. Precautions: we need to be concerned of pitting edema, lotion or stuff on the body, knowing the time limits, and looking for anesthetized skin. The treatment duration of ice immersion is typically 10 to 15 minutes. The temperature of the ice immersion is usually 50 to 60 degrees Fahrenheit. For smaller body parts, the temperature should be closer to 50 degrees Fahrenheit and approximately 10 minutes of treatment. For larger body parts, the temperature should be a little warmer, approximately 60 degrees Fahrenheit, and maybe a little bit longer treatment, about 15 minutes. Sometimes barriers are used to make the treatment more comfortable, including toe sleeves, as this is the most common complaint of individuals who participate in ice immersion. A cold whirlpool treatment combines ice immersion with the massaging effects of jets, the buoyancy effect from the water submersion, and the increase in hydrostatic pressure from the pressure that the water exerts on the body part. The use, indication, and contraindications are the same as cold immersion mentioned on the previous slide. The treatment duration for the cold whirlpool is approximately 10 to 30 minutes based on the amount of the body that is submerged. The more the body that is submerged, the warmer the water should be for the patient. The optimal treatment temperature is between 50 and 65 degrees Fahrenheit. For small body parts, the temperature should be closer to 50 degrees Fahrenheit and approximately 10 minutes of treatment. For larger body parts, the temperature should be closer to 65 degrees Fahrenheit and approximately 30 minutes of treatment. Barriers such as toe sleeves can also be used for comfort. Considerations for cold whirlpool use should include the examination of the skin for infection or open wounds, as the whirlpool must be disinfected between each treatment and/or patient. This is a substantial time and resource dedication. The treatment of cold whirlpool is often combined with stretch and exercise. Common exercises include ankle ABCs, circles, and ankle pumps. There is some research that has documented the effect of preventative cold whirlpool use on post-exercise to help prevent or decrease the effects of delayed onset muscle soreness or DOMS post-exercise. Cold whirlpool treatments are very common post-exercise among collegiate and professional athletes. The picture on the right is of the Major League Baseball Chicago White Sox hydrotherapy area. Many teams have dedicated significant resources to cryotherapy rooms. The use of water therapy is not unique to sports. There are several factors that make aquatic therapy effective for many patients. Buoyancy is the lifting force that is provided by the water. Many elderly patients find aquatherapy decreases the pressure on aching joints, making it easier to move and exercise. In addition, in a non-weight-bearing patient, aquatic therapy can help the patient regain a normal gait because the buoyancy effects allow the patient to exercise without the full effects of their body weight. Hydrostatic pressure is a force that is exerted on the body part that is immersed in a non-moving fluid. Hydrostatic pressure creates a pressure gradient which can help force fluids in a distal extremity to move proximally. Many people feel thinner in a pool of water due to this hydrostatic pressure creating a force on the body. Resistance is created against movement in the water if used for rehabilitation purposes. It can create a massaging effect if used for treatments. The water creates a resistance, which is an excellent form of therapy. Underwater running or other exercises are frequently used during rehabilitation protocols. Cold whirlpool treatments are great for irregularly shaped body surfaces, typically distal body segments. It combines the effects of cryotherapy with the effects of aquatic therapy, such as buoyancy, hydrostatic pressure, and the massaging effects of resistance. Safety is the most important thing. No patient should ever turn on a whirlpool while they are actually in the whirlpool. All whirlpools should be plugged into a ground fault circuit interrupter, or a GFCI. All GFCIs should be at least 3 feet off the ground in the event of water. A ground fault circuit interrupter is designed to protect the patient from electrical shock by interrupting a circuit when there is a difference in the currents in the hot and neutral wires. If there is a discrepancy of more than 5 milliamperes, current leakage has been detected and the GFCI will stop the flow of electricity. Ground fault circuit interrupters must be distinguished from standard circuit breakers. Although GFCIs stop the current flow at a very low amperage, standard circuit breakers require much larger discrepancy, up to 25 amps, to be activated. Circuit breakers are not adequate for the use in athletic training facilities, physical therapy clinics, or hospitals, especially in hydrotherapy areas. In 1991, the National Electrical Code required the use of GFCIs in all healthcare facilities that use therapeutic pools. GFCIs are easily recognized by their test and reset buttons. If the GFCI trips, disconnect the patient from the unit. Turn the power off to the unit. Check all connections. Depress the reset button on the GFCI and restart the equipment without the patient being in contact with the unit. Ensure that the ground fault trip does not occur again. If the GFCI trips again, disconnect the unit, label the unit and outlet as out of order, and call for service. Cryokinetics is the combination of ice and active exercise. Cryokinetics is good to use with acute injuries, inflammatory conditions, acute pain, and when we want to push out swelling. It is good for sprains, but not strains. Indications include swelling, acute injury, chronic injury, edema, and ligamentous injury. Contraindications: it does not allow patients to feel pain, so tissue could be damaged during exercise. We don't use this with open wounds, circulatory insufficiency, anesthetized skin, DVT, cardiovascular disease, allergy to cold, sensitivity to cold, or body type fat distributions that prohibit the target tissue from being cooled properly. Precautions: there is a possibility that the active exercise may increase the tissue damage if we go too far. We also have to be concerned about any circulation insufficiency that the patient may have. The treatment duration of the cryotherapy treatment is typically ice for 10 to 15 minutes or until numbness, followed by active exercise until the tissue starts rewarming. This ice and exercise process will be repeated approximately 5 times. The mode of the cryokinetics includes the use of cold whirlpools, ice immersion, ice massage, and an ice pack. Barriers such as toe sleeves can be used for patient comfort during the cryo treatment. Cryokinetics are most commonly used for ligamentous injury. The most common application of cryokinetics is seen with ankle sprains, most typically lateral ankle sprains. It is good to use cryokinetics when range of motion or strength is limited due to pain. Cryokinetics is not good for muscle strains, as active early exercise could damage the healing muscle. If pain is felt while the patient is still numb, then there is too much stress that is being applied to the tissue and we need to back off the treatment. Remember that the exercise may be simple, such as ankle pumps, toe raises, heel raises, or even simple standing or balance activities. Pain is always our guide to any rehabilitation protocol, but especially during cryokinetics. Some cooling modalities that have gained popularity recently. These include whole body cryotherapy units, cold chambers, and air cooling. Attendance of annual meetings and symposiums is a great place to check out new resources. This is a booth with a new proposed product. This is a cryo helmet. The guy at the booth graciously modeled the helmet for us. This unit has been marketed as a new concussion treatment with the theory that early application of ice or cryotherapy could help decrease the effects of concussion in much the same way as it does for acute injury. There is no research at this point in time that states the use of this cryo helmet has any effect on concussions, but it's being marketed as such a product.